Hi, it's Dr. Lee. I want to show you two exercises to keep your knee moving after surgery. After surgery, it's really important that you keep that knee moving. You're going to have physical therapy 2 or 3 times a week with a therapist, but I don't think that's enough. I think it's really important that you use this window of opportunity to get your knee moving really well as soon as you can so that you have the most useful range of motion from your knee. I've come up with two different simple exercises, one for straightening and one for bending. And you could do these exercises on your own at home, and I would start them right away. Maybe the first day if you're feeling well enough, but definitely by the day after surgery. In order to get the knee straight, I would find myself a chair like this, and I think it's better to have a pair of arms so that you can control your body with your hands. And I'm going to first show you the straightening exercise from the front. You're going to want to sit with your sitting bones at the far edge, the front edge of the chair, as far as you can. And I have this black and green stocking to demonstrate that this is my operative side, my right side. And what you're going to want to do is start by putting your heel on the ground, and then you can take your hands and gently push down above your knee. Your incision is going to be much less sensitive in the knee, on the top of the knee, but if you want to put your hand on your thigh, that's totally fine as well. And then what you're just going to do is press down gently with your body weight, with your trunk, and you're going to want to look down and see that your knee is all the way straight. Okay? So as seen from the side, you're going to want to take a seat on the front half of the chair, and then bring your heel out to as extended as you can go, and then take your hands, put it on your thigh, and gently and slowly push your knee straight. And again, you want to check with your eyes to see that your knee is coming all the way straight. And then once you're in this straight position, you want to hold it for about 20 seconds. The second exercise is to get your knee bent. You're going to want to sit all the way back in the chair for this exercise. You're going to take your left ankle and little by little move your heel backwards towards the bent position. It's very important in this exercise that as you're doing this, it can be painful, but as you're doing this, you don't want to raise your right rear end, the operative rear end, because that's cheating and you're not actually bending your knee when you're doing that. So make sure you're sitting square on the chair. So as you're going backwards, you may want to pause a little bit to give your body time to acclimate. It is going to be painful at first especially, but give your body time to adjust and don't be too sudden with the incremental bend as you're going. You're going to want to try to clear 90 degrees by about 2 weeks, sooner if you can, but it may be tough at the very beginning, so be patient with yourself. Once you get to about 90 degrees, you can hold your foot to the ground, put your hands on the armrests of the chair, and you can scoot your rear end forward a little bit at a time. If for some reason you don't have a chair with armrests, you can use a regular chair too. I would just put your hands on the seat itself and you can scoot your rear end forward. And so notice that I'm keeping my foot in the same spot on the ground while I'm pulling my rear end forward. And if you're strong enough and stable enough, you can actually almost or even bring your butt forward off the chair and go into a little bit of a dip. But make sure you have the upper body strength to do this. I don't want you falling and hurting yourself. I'm going to show you the same exercise from the side view. Again, for this exercise, you want to sit all the way to the back of the chair. And most of you will probably start with your legs slightly extended because that's the position of comfort. It's not easy and it's painful to try and bend your knee after surgery. So the way to get yourself started is to take your other foot, which in this case is my left foot. I'm hooking it around my right ankle. I'm sitting square to the chair, and I'm dragging my foot a little bit at a time towards the back. And again, it's important not to raise your rear end. You want to stay square and feel your sitting bones sitting evenly on the chair. Once you get to about 90 degrees, if you leave your foot on the ground, you can scoot your rear end forward and get more and more of a bend. Just a little at a time so you don't overwhelm yourself with pain. It may help to have a slipper or sandal or shoe so that can really anchor your foot to the ground. If you can do so safely, you can stabilize yourself with a non-operated leg, like my left side in this case, and bring your rear end forward and even come off the chair, as long as you have enough upper body strength to manage this. And this is something that you can hold for 20 seconds as well. I'd like you to do these exercises every day, including on days that you do have physical therapy. It's important to keep coming back to it so that you can continue to reinforce the maximal straightening and the maximal bending of your knee. As time goes on, most of you will experience that these exercises become easier and easier with time. And I would continue doing them as long as you feel like you need to maximize your potential range of motion. If you have any questions or concerns, please feel free to reach out to me or Jasmine. Both of us receive texts at any point, and let me know if you have any concerns. I look forward to seeing you get a lot better, and I know you can do it. Have a good one.